Assalamu alaikum. And from Dr. Hussain Bashkolachi, we are once again discussing the public health situation in the ceasefire and 40 days West Asia war. And as the public health is discussed least in the mainstream media and the top ranking channels. So I thought that I must, as a public health professional, take the independent view that what is the situation of public health. So without wasting time, but if you are new, Dr. Hussain Bashkola YouTube channel, please like it, subscribe it, and help us by pressing the button uh, so that we can have more views and more subscribers, and we can continue with our efforts and with our research and presentation so that the issues which are of the Muslim world, but they are least discussed even in the Muslim world, particularly the public health, because of certain constraint, and even in the Amro region, this war is basically affecting the entire Amro region. So the WHO situation in that conflict is as critical and central. So I appeal to the WHO that they will play its role, and even the uh, Medicines and Frontier, as well as the Red Cross, or we call it Hilal Amar, will also play. So this is perhaps the last slide, which is a default in my presentation, but it is, I think, the bottom line, and it is the central point. The time is running out. The 10-day ceasefire is the last window to prevent generational health, not of this generation, but the coming generation will also face the health outcomes. Catastrophe, immediate international action is not optional, it is a moral imperative for millions of innocent lives. Act now, save lives, secure the future. Your future is on public health, not on the land, water, and the political boundaries. But if you are healthy, happy, you will contribute in the economic, social activities, then only the country can prosper and life can be better. Otherwise, you will go 1,000 years back in the same situation of the dark ages or the middle ages. So, public health crisis, it is a crisis in that part, and these are almost 7, 8 countries directly affected, but the Iran is the center of the gravity, and the Iranian health system has faced this level of the damage. I think that's unprecedented in the history of the medical health care or medical care. So, assessing the public health impact of the 40-day conflict, cesium 137 contamination, which is one of the important aspect. I heard in one of the Professor Jiang from the China, he discussed this. So this contamination will contaminate the water, and ultimately this contamination cannot be dealt by the solar as plants, water filtration plants, or any plants, and ultimately it can be a very important public health research as well as environmental hazard. And the state of Hormuz blockade during a fragile 10-day ceasefire. So, what is public health? This was a professional briefing which I have made with the help of artificial intelligence, which I am still learning, but I think the professional should learn how to deal with the artificial intelligence. And you can see in the background, the thumbnail also shows that the black clouds or red clouds are there, and the factories and their situation, the fire is just going up to the sky. So this is public health actually, not under the fire, gunfire, but really it is burning issue or the public health is burning. So let us see the agenda of the briefing is conflict overview and timeline, nuclear targets and infrastructure damage, cesium-137 contamination, water, air, and ocean. That is basically the message which I want to convey because I heard this Professor Jiang presentation that this is a problem. State of Hormuz blockade and supply chain, including the vaccines, surgical things, medicine, and even the transportation or the reaching or access of the critical healthcare manpower also. Healthcare system collapse and drug shortage, future scenario if ceasefire fails, what will happen? So these are the 6 points we will discuss, but let us have an executive summary, a public health emergency. Why? 40 days escalation across the Middle East. US and Israel forces launched sustained military operation targeting Iranian nuclear infrastructure. Iranian nuclear infrastructure uh, triggering, yes, triggering a severe humanitarian crisis across the region. So you can see that this sustained military operation of the 40 days in a poor country, in a country which had not fought any war in 100 years, in a century. This was told by one of the American professional and war and defense analyst. Cesium-137 contamination released. Strikes on nuclear facilities in Isfahan, Lebanon, and Oman released radioactive cesium-137 into waterways and the Persian Gulf, threatening millions. You look at, I am not saying this is artificial intelligence made presentation. And you can see that how this world of the information is transforming. Yesterday, I was discussing the World Health Day, which says together for the health and stand with science. So this is science. Cesium, its contamination is not a social issue, it is a science issue. State of Hormuz blockade paralyzes supply chain. The blockade cut off shipping lanes for pharmaceutical and food, creating acute shortage of life-saving medicines. Life-saving medicines are not available in Iran, Iraq, and in neighboring countries, or almost all the countries. Fragile 10-day ceasefire under strain. A 10-day ceasefire offers a narrow window for humanitarian aid. If negotiations collapse, the healthcare delivery system faces total disintegration. Total disintegration. That is the situation where we are seeing this conflict timeline, 40 days of escalation, first 10 days, then 11 to 25 days, and 26 to 40 days. I am just full-scale naval confrontation in the Persian Gulf, shipping halted, radiation spreads to the ocean currents, healthcare system overwhelmed, drug and food supplies run critically low, international pressure leads to 10-day ceasefire negotiation. This is the 40-day story. I am just for the briefing of the time. Let us have a nuclear and energy infrastructure under attack. Isfahan nuclear facility, primary target sustained bombardment, damage reactor containment, confirmed cesium-137 release into the Zaida river and atmosphere. Zayadan, Zayad river and atmosphere. Look at the damage. Look at the damage. The river is now contaminated, and it is confirmed. Lebanon suspect research reactor strike near Beirut caused secondary contamination, radiation detected in coastal waters of the eastern Mediterranean. So this is IAEA actually report. Strikes near Beirut, and then Oman power grid and desalination plant. Energy infrastructure targeted, disrupting water supply, indirect radiation exposure from fallout drifting across the Gulf. So this is a public health crisis which I want to highlight, and you can see in the map where these nuclear facilities were and how cesium-137, which is one of the radioactive substance and that um, cannot be removed from the water by any water supply system or even desalination plants. And you can see that Isfahan, Lebanon, Oman, and these were the peaceful, particularly in Oman, desalination plant was running on the energy of the nuclear peaceful plant generating electricity, but now it is source of contamination. Let us see what is next. Cesium-137 contamination, which is basically my public health issue, and I want to bring it because nobody is talking except Professor Jian. Cesium-137 contamination radiation crisis. 300 plus time safe limit in water near Isfahan. 300 times safe limit in water, which is no more. 15 million people exposed to the radiation. Look at the problem. 800-kilometer fallout plume radius detected. The cesium fallout 800 kilometer, and it will take 30 years cesium-137 half-life period. So you can see that the danger is almost catastrophic and apocalyptic. Cesium-137 has entered the Zayada River, Quan River, and the Persian Gulf. And this is ocean. Desalination plants in Oman and UAE are compromised. Groundwater in southern Iran shows elevated radiation levels affecting agricultural irrigation. So now it will reach to the food chain also. Airborne and ocean spread radioactive particles detected as far as Pakistan, India, and ocean currents carry contamination through the Strait of Hormuz into the Arabian Sea. Marine ecosystem in the Gulf face catastrophic collapse with bioaccumulation in the fish population. So now the Pakistan and Iran, they are also under threat from the public health point of view. You can be saved from the bombs, missiles, and Tomahawk missiles, or even you can have RS system of the missile, but this public health will affect 30 years. This 10 days ceasefire will not stop this kind of public health crisis. So that is a danger, and this presentation is not only to understand the present situation, but highlight the impact of the public health on the region as well as the neighboring countries, including India, Pakistan. Once again, I am just say radioactive particle detected as far as Pakistan and India. Ocean currents carry contamination through the Strait of Hormuz into the Arabian Sea. So this is a statement which is artificial intelligence detected search engine. This is not my personal. Then coming to this radiation health effects on population, what will happen? Acute radiation syndrome. These you can see that 12,000 confirmed ARS cases, acute respiratory syndrome cases, GI bleeding at high doses, immune system collapse, bone marrow suppression, nausea and vomiting within hours. Then long-term health effect, thyroid and blood cancers, genetic mutation, birth defects, miscarriages, chronic liver and kidney diseases, mental health trauma, epidemic, vulnerable population, children 3 to 5 times more sensitive children, the flowers of our society, whether they are in any country, a pregnant woman at fetal risk, elderly with reduced capacity, refugees without screening, fishermen or fishermen consuming toxic seafood. I should go fast. Environmental catastrophe, ocean and air. Persian Gulf marine ecosystem collapse. Radioactive isotopes detected in Gulf waters at 50 times background level. Marine species showing acute radiation poisoning. Fishing industry shut down across Iran, Oman, UAE, and Qatar. Coral reef, which is the lifeline of the ocean life or marine life in the Arabian Gulf, face irreversible die-off and bioaccumulation of cesium-137 in the food chain will persist for decades. Atmospheric radiation plume. Wind patterns carried radioactive particles across the Arabian Peninsula, South Asia, and East Africa. Iodine 131 detected in rainfall as far as Mumbai and Nairobi. Long-range atmospheric transport models predict contamination will reach Southeast Asia within weeks. Agricultural lands across 6 countries may be affected by radioactive deposition. 6 countries, agricultural crops or land, and you know that 30 years and decades this land will not be safe. So I think that is the situation of the public health. I should see. I have, yes. Let us see complete shipping blockade. All commercial traffic halted, oil tankers, cargo ships, and humanitarian vessels unable to transit, naval mines and military vessels blocked, 21-mile wide strait connecting the Persian Gulf to the Arabian Sea. Pharmaceutical supply, which is important for us, critical medicines including insulin, chemotherapy drugs, antibiotic and chemotherapy are the essential drugs for the cancer patients. Antibiotics and vaccine trapped in transit. Iran imports 70% of its pharmaceutical. Iraq and Afghanistan depend on Gulf ports for medical supply because Afghanistan is a landlocked country. Food security emergency, that is another area. Grain imports for 90 plus million people. 90 plus million people. You can see that 10 crore people disrupted. Qatar, UAE, and Kuwait face food rationing. Refrigerated containers of perishable medicines and food spoiling at anchored ports across the Gulf, perishable vaccines, drugs which require a continuous maintenance. So, strategic checkpoint 21% of global oil passes through the Strait of Hormuz daily, but I think the food as well as the pharmaceutical and even the fertilizer necessary and even the seeds and fresh vegetable fruits all are now uh, a perishable commodity are life-saving and economic. So let us see what is next. Drug and medical supply crisis. Critical drug shortage, insulin and diabetes medicine. You know that they have 3, 4 times requirement of injecting the, so all the diabetic patients are under threat. Chemotherapy and radiotherapy drugs, antibiotics for radiation induced infection, potassium iodide radiation antidote. This is important for the postgraduate MBBS and other. Potassium iodide radiation antidote is in short supply. IV fluids and blood products are in short supply. And anesthetics for emergency surgery, they are. Medical infrastructure damage, 37 hospital damage or destroyed, power grid failure, disabled equipment, lack of clean water for sterilization, staff shortage for casualties. So this is the picture of the healthcare system on the brink of collapse. So hospital overwhelmed, medical facilities across Iran, Iraq, Lebanon, and Oman at 400% capacity. 400% capacity. Patients are 400% more than the capacity of the hospital. Radiation victims complete with war, compete with war. Casualties mark capacity exceeds in 14 cities, means the dead bodies cannot be accommodated at least in 14 cities. Cancer treatment disrupted, 200 cancer patients, 200,000, 2 lakh lost access for treatment. Radiotherapy machines damaged. Iran's oncology system serving 85 million is not functional. You can understand that 85 million oncology patients are system serving 85 million people is not functional. 85 million means almost 8 crore people. Maternal and child health risk, prenatal care suspended, vaccination halted for 8 million children, and NICU without power. Expectant mothers face radiation exposure. So the future generation will have this kind of public health crisis. Mental health emergency, post-traumatic syndrome, uh, and depression of epidemic level, no medicine available, healthcare workers traumatized, suicide rate spiking across affected population. But I think the doctors and we also have a concern about the health in the Israel side also, and even the American soldiers are killed. So I think it is a multifaceted and it is a public health crisis overarching the political and the geographical boundaries or even the government systems. So let us have, if ceasefire fails, future of healthcare delivery. 50 million without healthcare, 1 million excess deaths in a year, 85% hospital will be destroyed. And then we have the 30 years recovery time, or let I should see that what is the 10 years recovery time. 10 years recovery time. So total healthcare system failure, generational health impact, cesium-137 will cause elevated cancer rates and genetic mutation for 3 to 4 generations. International support needed for decades and regional epidemic cascade, cholera and typhoid for contaminated water, radiation or uh, radiation compromised immune system, mass displacement with zero sanitation, disease outbreaks could kill more than the conflict itself. So the public health deaths will be more than the conflict deaths. Mass refugee health crisis, over 20 million displaced, no host country health system can absorb the influx. Chronic diseases management, abundant and maternal mortality rate projected increase 500%. Mothers will die due to birth of the children because of the radiation and other things. I think this is the scenario. With this, I think I am completing this video, though I am emotional, but I think the public health crisis has been depicted very well, and this will be the eye opener for WHO, for the United Nations, even for the government, and even for the warring countries that the people will die more from diseases than the crisis from the missiles and tomahawk and other uh, things, and people will suffer, but the impact is as per this towards Arabian Sea, towards South Asia, and air, water, as well as cesium-137 element is released and it is confirmed, and IAEA, the international body of the atomic energy, has warned, and I will request the other public health professionals and the anchor persons from CNN and from Al Jazeera. The public health crisis should be discussed more because Pakistan will also suffer, being the next door neighbor and a Muslim country and a close uh, Muslim brother, and having a relationship with Iran as well as in the Gulf countries. So we request for the peace, not for the political gains or the victory gains, but for the public health restoration. And you can see that recovery time will be not 10 days, but 10 years. Thank you very much, Dr. Hussein Bashpolachi. YouTube channel today was a little bit emotional, but I think please like it, share it, and I think this has given a complete briefing of a professional level, of a scientific level, and I dedicate this video to the World Health Day, which is 7th April, every day celebrated since 1950. On that day, the Constitution of the World Health Organization, and I will request Dr. Tedros as well as the EMRO Director General that this presentation can be of eye opener for the policymakers, for the kings, for the rulers, for the common people, and even for the generations to come. Thank you very much from the Dr. Hussein Bashpolachi YouTube channel. We shall continue our efforts, and if something has added, please like it, share it. Thank you very much. And with this, I am ending this video on a very important topic. Thank you very much.